Welcome. The attendees are just getting into the room, so we'll give this just a minute, but welcome to the webinar today. Thank you for joining us. I see the attendees are populating the room, so we will let that number grow for just a second. Welcome to the Spotlight on the Coronavirus Response and Relief Supplemental Appropriations Act of 2021, which we today will call CRRSAA, funding for 5310 direct and designated recipients. I'm Carrie Diamond with the National Aging and Disability Transportation Center. Who is joining us today? So we have over 450 people registered. About half are direct or designated recipients. We have many sub-recipients, tribal recipients, some who are not recipients of 5310 funding, as well as some interested in applying for the funding. Just quickly, some instructions for your Zoom webinar participation today. All participants are muted. If you would like to communicate with the event hosts, you can do so through the chat function. We ask that your questions are put into the Q&A function. And the reason for that is the chat continues to scroll, and so your question could be lost. So if you click on the Q&A function, that will be only questions there, and it will be easier for us to look at those. Though any questions will be answered at the end of the webinar. This webinar is being recorded. The webinar is being live captioned. To view the captions, what you can do is there is the CC button to enable the closed captions. If you prefer the live transcript, in the chat, there is a link to the stream text. So this webinar today is for informational purposes. Press inquiries should be directed to FTA Press Office directly. A little bit about the National Aging and Disability Transportation Center. So we are funded by the Federal Transit Administration as one of the technical assistance centers, administered by a partnership between the National Association of Area Agencies on Aging, or N4A, and Easter Seals. NADTC was launched in 2015, and the purpose is to promote the availability and accessibility of transportation options that serve the needs of older adults, people with disabilities, and their caregivers. One of our focuses is on the Section 5310 formula grants. Our objectives are to include person-centered technical assistance, information and resources, training, communication and outreach, coordination and partnership, and investment in community solutions. More information can be found on our website at www.nadtc.org. So it is my pleasure to welcome from the Federal Transit Administration, Marianne Stock, who is the Division Chief of the Rural and Targeted Programs, as well as Destiny Buchanan, who is the Acting 5310 Program Manager. So Destiny, if you'd like to start sharing the presentation, I'd like to remind participants that if you have questions, that you can put those at any point in the Q&A box, and we will get to those at the end. Thank you, and take it away, Marianne and Destiny.
All right, so good afternoon and welcome again to the Coronavirus Response and Relief Supplemental Appropriations Act, or CRRSAA, for 5310 recipients. Again, my name is Destiny Buchanan, and I am the Acting 5310 Program Manager. And here with me today is my supervisor, Marianne Stock, who you'll be hearing from a little bit later. I'd like to begin by stating that this webinar does not have the force and effect of law and is not meant to bind the public in any way. The webinar is intended only to provide clarity to the public regarding existing requirements under the law or agency policies, Grantees and subgrantees should refer to FTA statutes and regulations for applicable requirements. Since the COVID-19 pandemic began, FTA has allocated over $25 billion in CARES Act for funds for transit providers, used our emergency relief program to allow the urban and rural area programs to be used at 100% federal share for COVID-19 related expenses, including operating. We extended the deadlines and due dates for competitive grants as well as reports, and postponed oversight reviews and the NTD reporting requirements. Last but not least, we distributed more than 14 million cloth face coverings to 2,200 transit systems and issued a safety advisory with recommended actions to reduce the risk of COVID-19 among transit employees and riders. CRRSAA provides $14 billion to support the transit industry in response to COVID-19. Of those funds, $13.26 billion was allocated to the 5307 program, $678 million was allocated to the 5311 program, with $30 million of those funds allocated for tribal formula. $50 million was allocated for the 5310 program, and $10 million was allocated for administration and oversight. And I am happy to say, as of today, we have obligated one CRRSAA grant for 5310, and that was awarded to the Stark Area Regional Transit Authority in Ohio. All projects funded by CRRSAA are available at 100%. Sorry. Unlike the CARES Act, CRRSAA allocated funds for the 5310 program and emphasized that funding is made available for payroll and operations of public transportation first and foremost. All projects funded under CRRSAA are available at 100% federal share and are allowed pre-award authority beginning on December 27th, 2020. These funds are available until they are expended, which means that there is no lapse date, and recipients are encouraged to use funds quickly and for operating and payroll expenses. Any entity that is eligible for the 5310 program is also eligible for 5310 CRRSAA funds. This includes entities that have not received 5310 funds in the past and include state and local governments, designated recipients, private nonprofit organizations, tribes, and operators of public transportation. I am now giving it over to Mary Ann. Mary Ann is on mute.
Thank you, Destiny. Am I off of mute now?
Yes, I can hear you.
Okay. So I'm Mary Ann Stock. I'm the Chief of Rural and Targeted Programs at the Federal Transit Administration, and my office manages the 5310 program that we've been talking about, as well as the Section 5311 Rural Transit Program, the Tribal Transit Program, and a few other things. So I'm going to get into a little more detail now about how the CRRSAA 5310 funding works. So apportionments for large urbanized areas, small urbanized areas, and rural areas are already posted on the FTA website. Similar to annual Section 5310 apportionments, the apportionments are listed by state and by designated recipient. The state or designated recipient for each area will determine how the funds will be allocated to subrecipients within their area. You can go to the next slide, Destiny. There you go. Recipients in shared urbanized areas are encouraged to coordinate with the designated recipient to obtain their allocation. And they will have to work, if applicable, they'll need to be providing a split letter to FTA. And this would be very similar to what they normally do with their Section 5310 funds. Subrecipients will also need to coordinate with or wait for direction from the direct FTA recipient regarding their allocation. Next slide. And the same type of activities that are eligible under the regular Section 5310 program are eligible for funding under CRRSAA. However, Congress did make it clear that to the maximum extent possible, funding should be directed to payroll and operations of public transit, and that can include payroll expenses of private providers such as service contractors that are providing public transportation. Capital expenses such as vehicle purchases are only allowable if the recipient certifies to FTA that they have not furloughed any employees. Next slide. And operating expenses for all recipients and all types of recipients are eligible, beginning with any expenses that may have started on December 27th, 2020. Examples of operating expenses include administrative leave of operations personnel due to reductions in service or quarantine, vehicle operator salaries, fuel, any items with a useful life of less than 1 year, and PPE, which would generally fall into the category of items with a useful life of less than 1 year. So if you need special, masks for employees, et cetera. Here's some exceptions under CRRSAA. So the requirement that many people are familiar with, at least at the recipient level, direct recipient level, to use 55% of Section 5310 funds for traditional capital projects, that does not apply to CRRSAA funding. Again, that's going back to Congress wanting to encourage the use of as much CRRSAA funding for operations as possible. And the other thing is that funds that were previously appropriated but have not yet been obligated, in other words, are not yet in a grant from FTA, can be awarded at a 100% federal share. But that funding, if it's not CRRSAA funding, it still has to meet the 55% requirement. And it also has to be included in a coordinated plan. Next slide. All of the general federal transit program requirements apply to CRRSAA funding. As I mentioned earlier, if split letters are required, if they are applicable in your area, there are a couple of exceptions to the all federal transit program requirements rule. Some expenses don't need to be in a TIP, transportation improvement plan, or a STIP, or a long range transportation plan. Those would be operating expenses or capital expenses that do not involve a substantial change to the location, function, or capacity of an asset. Just as with regular Section 5310 funding, the Coordinated Human Service Transportation Plan requirement does apply to CRRSAA funding. That means that Section 5310 Section 5310 activities that are funded through CRRSAA must be part of a locally developed coordinated human services transportation plan. States and designated recipients do have flexibility to allocate CRRSAA funding through a different process than the one described in a previously approved state management plan without getting prior FTA approval. But they should be sure to document any deviations from their previously approved plan in an attachment when they apply for the CRRSAA funding. An example of the type of deviation that I might be talking about would be giving priority to operating funding, for example, since that's a very specific change implemented by CRRSAA. If your state management plan doesn't address that, you can still do that. So go to the next slide now. Okay, this is just some kind of technical information. I'm not going to dwell on this. If you're a direct recipient constructing a grant for CRRSAA funding, here are your codes that you're going to need for that. The most important thing probably on this slide is that CRRSAA grants from FTA should not be combined with any other funding sources. And of course, you can work with your FTA regional office on any other questions you might have about the grant administration. Next slide. So these are some resources for more information. We have some links here Of course, there's lots of information on the FTA website. We have frequently asked questions that have been posted, and they've all been relatively recently updated to address the CRRSAA funding in addition to what was previously there, which was basically about the CARES Act funding that didn't include 5310. As I mentioned earlier, the CRRSAA apportionment tables are posted, so you can look there to see what the funding is for your area. There was an FTA webinar held on January 12th about CRRSAA funding more broadly, including 5310, as well as the other programs that are funded through CRRSAA. And of course, the Section 5310 circular is a great resource. There will be an apportionment notice published in the Federal Register specific to CRRSAA funding. That has not been published yet, but once it is, it will be available on the FTA website. Next.
That's it from us.
Oh, and here's the contact information for myself and for Destiny. And I believe that is the end of our little presentation. Of course, we'll be around for questions when the time comes. But I'll pass it on to our other speakers now.
Great. Thank you so much, Marianne and Destiny. Really appreciate that. And we have several questions coming in. But before we do that, we're going to have two short presentations by some direct and designated recipients. And the first one, I welcome Jennifer Sarnecki. She is a principal transportation planner with Southeastern Wisconsin Regional Planning Commission. Jennifer, go ahead.
Great. Thank you. And thank you for the opportunity to present today. So just a brief overview about the organization that I work for. The Southeastern Wisconsin Regional Planning Commission is the official metropolitan planning organization and regional planning commission for the 7-county Southeastern Wisconsin area, as shown in the map here. And for the 5310 program, Milwaukee County is the designated recipient, but we coordinate with them to manage the competitive selection process for the 5310 program. And on the map here, what the yellow area is showing is the Milwaukee urbanized area. And that includes primarily the counties of Milwaukee, Waukesha, Ozaukee, and Washington. And then there's smaller parts that delve into adjacent counties as well. And as you know, eligible applicants must mostly serve areas within the Milwaukee urbanized area. And if an applicant is looking to serve areas beyond this yellow area, we work with our partners at the Wisconsin Department of Transportation to help them apply for the statewide 5310 program. And then we also document all this and our responsibilities and the process within our program management and recipient coordination plan, which can be found on our website as well. And we do have evaluation criteria when we do our project selection. Those are largely based on criteria utilized by the Wisconsin Department of Transportation, so we coordinate closely with them. And those are also based on the 5310 circular. And when we do evaluate projects, we assemble a scoring panel, and that is also made up of staff, my colleagues at the commission, as well as a panel member from the Wisconsin Department of Transportation. And then overall, we do look at criteria including the demonstration of need and service benefits. We also promote coordination of services among the counties. And then we also consider the financial and technical capabilities of the applicant. And then earlier it was mentioned about the transportation coordination plans. Of course, all projects that are funded need to be in a coordinated plan. And another one of our roles at the commission is that we do help facilitate the planning process for the coordinated plans for each county in the region. Next, I'll delve into the specific operating projects that we have funded in recent years. Typically, these have included volunteer driver programs, but more recently, there have been programs to implement a one-call, one-click transportation service. So now I'll get into a little more detail about the volunteer driver program. Primarily, these funds for these projects have gone to 3 subrecipients, one being ARRA's Senior Network, another is Interfaith Caregivers of Ozaukee County, and Washington County Interfaith. And overall, these programs provide door-through-door service and it's companion transportation service that's utilized by a volunteer or a volunteer utilizing their own vehicles, or they may be utilizing a vehicle that is owned and operated by that individual organization. And then the 5310 funds generally are supporting salary, office space, office supplies, equipment, and software. Now, the in-kind match, and I know that doesn't necessarily apply for the CRRSAA funds, but perhaps thinking ahead to future years, the in-kind match has been provided by volunteer driver hours and local donors. Another program, another operating program that's been funded in our region has been the One Call, One Click program. And that service is a complement to the volunteer driver program implemented by ARRA's Senior Network. And it seeks to address transportation needs of seniors and adults with disabilities who aren't able to be matched with a volunteer driver. And this program, similar to the volunteer driver program, provides door-through-door service to healthcare and basic needs destinations. And the program is based on a computerized system that helps match rides as well as track riders, or track usage rather. And the budget for this program typically includes salary, software, and related administrative costs. And then just a couple final notes about our operating program in general, our operating projects. Typically in the most recent application cycles, operating projects have comprised about 25% of the total federal funding received. And overall, our Milwaukee urbanized area typically receives just over $1 million per year in Section 5310 funding. And my final point would just be to note that our program, our 5310 program, has been oversubscribed in recent years. Most recently, it's ranged between 200,000 and 400,000 over. So with that, I'll conclude my presentation and I'll turn it back to Carrie, and I look forward to your questions.
Great. Thank you very much, Jennifer, for your presentation on how it's done in Southeastern Wisconsin. Next, I will turn it over to Jennifer Henning, who is the manager of grant programs at the Massachusetts Department of Transportation. Go ahead, Jennifer.
Great. Thanks so much, Carrie, and hi, everybody. I fear that my portion will be a little bit longer than everyone else's, so I do apologize. But as Carrie said, my name is Jenna Henning, and I'm the manager of grant programs at the Massachusetts Department of Transportation in the Transit Division. And I administer the Commonwealth's disbursement of FTA Section 5310 funding through an annual competitive grant process called the Community Transit Grant Program. So it looks a little bit differently than the other Jennifer's program. And we refer to this as CTGP, so bureaucracy and its beloved acronyms. If you hear me reference it as such, now you know what it means. In addition to Section 5310, we also allocate state mobility assistance program MAP dollars through CTGP, and this funding stream is only used for fully accessible vehicles. It's about $4 million a year from the legislature. We utilize the FTA 5310 allocation for vehicles as well as mobility management and operating projects. And so it's that operating piece that Carrie wanted me to talk about today. So I'll delve into our grant process a little bit as it relates to distributing 5310 funds for operating expenses. As I mentioned, Massachusetts uses a competitive grant process to assign awards, and it's an annual program. So to start, I'll provide a brief overview of the application cycle and project implementation timeframe, just kind of for a quick snapshot of how the program runs. And this timeframe is approximate. We try to keep it on a similar schedule year after year, but it doesn't always pan out that way, as I'm sure you've all experienced too. We kicked off the state fiscal year 22 award cycle. Our state fiscal year runs July 1st to June 30th. And we hosted a webinar that provided an overview of the grant program and featured a few of our current operating subrecipients in what we referred to as a talk show style interview. And they shared information about their respective programs, which highlights various best practices that we at Mass DOT would like to see replicated. And I'll talk about those best practices later so that you can have an idea of what we're looking for in an operating applicant or an operating project applicant. So that served as an introduction to the program and a way to get folks thinking creatively about what can be done with those operating or mobility management money. We'll host another webinar this spring, and I say webinar, they would be in-person trainings or happenings, but for the purposes of grant cycles thus far this decade, all virtual. So that webinar in the spring is an application training session where we go into those sort of like nitty gritty details of the application and requirements for applying to CTGP. We technically have 4 separate applications. So we have one for new vehicles, whether that's to expand an existing fleet or create a brand new transportation program. A second to replace vehicles that have reached their useful life benchmarks. A third for mobility management projects, which is kind of like our catch-all non-operating and non-vehicle capital requests. And then our operating application. So no matter the type of application, once it closes, each goes through a threshold review. So sort of like those that Jennifer's organization uses, this project needs to be covered in the local coordinated human service transportation plan. And we want to make sure that that entity will be able to handle federal funding. We ask for quarterly reports from each operating recipient just to make sure that they're staying on top of things. And it can be quite burdensome sometimes. So we do a risk assessment just to make sure that we are awarding funding only to entities who will be able to, properly utilize these funding streams. So what are we looking for in an operating project application? We utilize the definition of eligible operating projects as explained in the FTA section 5310 circular. So initiatives that either exceed the minimum requirements of the ADA outside that complementary paratransit service that must be provided within 3/4 of a mile of a bus route or rail station, that improve access to fixed route transit, or that provide alternatives to public transportation. There are 15 regional transit authorities in Massachusetts, in addition to the MBTA, which is the Greater Boston public transit provider. And it's important that we're not funding projects that duplicate existing transit services. Like many states, we are a mix of urban, suburban, and rural. And the RTAs do a great job of providing service in their region, but as is the nature of transportation, especially in decentralized states like Massachusetts, where localities and municipalities have a great degree of self-determination, there are gaps in service, and especially for older adults and people with disabilities. So examples of operating projects that we funded in the current round of the Community Transit Grant Program, so we're in that state fiscal year 21 award cycle, that would fit into those 3 categories that I previously mentioned. I have 3 examples that I'll sort of go over with you guys. So exceed the minimum requirements of the ADA. An example of this is the Brockton Area Transit Authority's expanded paratransit services to 3 towns that are beyond their ADA corridor. About 50% of that community, or 50% of those communities as a whole, are not covered by BAT's ADA service provision and are they're underserved. So BAT applied to the Community Transit Grant Program to provide service above and beyond, that ADA requirement. And we have councils on aging in Massachusetts, and councils on aging are they're municipal agencies that provide local outreach, social health services, advocacy, information, and referral for older adults, their families, and caregivers. And we provide a great deal of funding to those councils on aging. And so even within BAT's service area, those COAs were not able to provide enough service to meet the demand. And we provided them funding, and their operating project award covers driver's dispatch and salaries, driver's dispatch and fringe benefits, and vehicle insurance. So that's an example of one type of operating project and a couple types of operating expenses that are eligible under the Community Transit Grant Program. Another one would be improve access to fixed route transit. I unfortunately would say that that's probably the operating project that we fund the least. But we do have an example of this, and that is Crosstown Connect, which is a transportation management association. So just a partnership between public and private providers in where are they? So they're in probably like northwest Boston, or northwest of Boston, which, if you can see on the map and are not familiar with Massachusetts geography, is sort of all the way to the right in the center there, along the coast. And so Crosstown Connect covers municipalities that fit between a couple RTA boundaries, and they provide common all-day dispatch for 8 demand response vehicles, which serve the needs of older adults and people with disabilities in their communities, and connect to a couple fixed route transit stations. So they're a great example of how these public and private partnerships can combine to create a really robust transportation network that can get folks around and within different RTAs. So their funding for state fiscal year 21 covers contract purchase services. Basically, they have an operating contract with Transaction Associates, Inc. to provide all of their services. So purchased contract services is another popular operating expense in Massachusetts. And provide alternatives to public transportation. I would say that that's one of the ones that we fund the most. So also similar to Jennifer, we have a lot of really fantastic volunteer driver programs in Massachusetts. And one of the ones that came to mind in thinking about providing an alternative to public transportation is Northern Essex Elder Transport, or NEAT. And it's a nonprofit volunteer driver program that serves older adults in 14 communities in Northeastern Massachusetts. So they have 119 volunteer drivers and 2 paid part-time administrative staff. So it's really, really amazing to see what these folks can do with, I think that their first request was probably for $3,000 for a $6,000 total project cost. And now they're up to $36,000 in total project cost. So folks can do a lot of really innovative and wonderful stuff with, what other transportation providers might see as a small drop of funding, or whatever that saying is. And so they receive operating funds for transportation project direct administrative expenses, which is like rent, office supplies, telephone services, volunteer insurance, and outreach campaigns. So those are a couple examples of operating projects, and I'm trying to keep an eye on my time, so tell me if I'm rambling for too long. But eligible entities for us are also important to include. So, you have those regional transit authorities, municipalities, which include councils on aging, and nonprofit entities. Those are the major entities to which we provide funding. And I kind of already went over some of the eligible expenses. If folks have questions after this goes on, please feel free to reach out to me. My contact information is provided. And I included our website, which has some supplemental information about how we choose to fund projects. Earlier, I mentioned best practices. And outside of the sort of by the book eligibility requirements and those few other things that were mentioned, the CHST plan, ability to handle federal funding, we really look towards a few mobility ideals to prioritize. And when thinking through those best practices, these are the 4 things that really came to mind. Respond to an unmet transportation need. Again, we don't want to duplicate existing services. Coordinate with partners across sectors, especially those that regionalize their efforts to create a robust transportation system that operates across municipal boundaries, like that Crosstown Connect, and a couple other examples that come to mind. We want projects that include riders in planning and design. It's really important to us that these projects are inclusive in the way that they are created and the way that they are carried out throughout their lifespan. We also want to prioritize, of course, as is the nature of FTA Section 5310 funding, prioritize transportation for older adults and people with disabilities while offering unused seats to the general public. We have a couple great examples of projects that, have unused capacity, and they open it up to, a workforce population that might not otherwise be eligible for this funding. So that's sort of an overview of the Community Transit Grant Program. And I also wanted to go over COVID-19 and PPE and how, the past almost full year now has impacted the way we operate this program. So our state fiscal year 21 5310 application was due about 3 months after the pandemic hit full swing in the US. So it was due in June. And the uncertainty led many folks to think about providing transportation kind of outside of the confines of COVID-19 because our operating projects generally coincide with the calendar year. And it made sense that folks weren't thinking like, how might this impact a January 2021 operating project start date? So what we did was allow state fiscal year 20 so that operating project cycle that would have been happening during the pandemic, so 2021, calendar year 20, I forgot what year we were in time. And then we allowed those and the state fiscal year 21 entities to edit existing applications to accommodate COVID-19 operating expenses. So that was cleaning supplies, personal protective equipment. And I would say that the volunteer driver programs in the Commonwealth were most vocal about their PPE needs. I guess I say that anecdotally. And due to the nature of their transportation program being volunteer-based and operating out of the vehicles of the volunteer drivers themselves. They didn't have the infrastructure in place to provide the PPE like maybe some of those other transportation providers who have larger operating budgets. And then that sort of jumps into CRRSAA and how we in the Commonwealth decided to, or are working through the decision to distribute that funding. And we wanted to share the money with 5310 subrecipients as again, we are a direct recipient. We wanted to look at who would need that money the most. And we know many entities are hurting and, the populations that these $5310 are meant to serve are disproportionately impacted by COVID-19. And it was important to us to make sure that we were putting these dollars where they might be most needed and where they could go the furthest. So that meant to us, we were prioritizing the nonprofit 5310 subrecipients. Since state fiscal year 18, we awarded operating funds to 6 nonprofit entities, and we're allocating funding to them for operating and administrative expenses before opening up any remaining funds to municipalities who've received vehicles previously. And looking through previous rounds of COVID relief funding, it was clear to us that a lot of the nonprofit entities which we fund had not received the same level of relief as others. We haven't fully fleshed out this process, and there are a myriad of competing priorities to consider, as you all know. But that is our plan for now. Again, sort of prioritizing those NPOs. That's pretty much all I had for you. Thank you for your time. Again, my contact information is provided as well as links to the Community Transit Grant Program informational site. So please feel free to reach out with any questions, and they don't just have to be about operating projects. I'm always happy to connect about anything mobility related. So thank you so much.
Excellent. Thank you so much, Jenna. So now we are getting to the Q&A, and there are quite a few questions. And I'd remind you, if you have any questions, to please put those in the Q&A function. I've been reviewing them, and if our panelists, particularly Marianne, Destiny, but also Jennifer and Jenna, if you'd like to start your videos, we can have everybody on here together. And I will consolidate some of these questions. And the first one, there's quite a few questions about the definition of furlough and what it takes to certify that an agency hasn't furloughed any employees. Marianne or Destiny, can you speak to that aspect of the CRRSAA funding, please?
Yes. Actually, what I'm going to say is that FTA is actually still in the process of developing more detailed guidance. They're is one or two FAQs already posted, kind of broadly explaining the procedure for the certification. But we are still in the process of understanding all the questions that people need answers and developing the answers. So it's going to be very helpful to me that we had the webinar today, and I'm going to use a lot of the questions that we got to help us guide us on what kind of information we need to get back to you all on. But unfortunately, I don't actually have the answers today. But do watch our watch the FAQs. They will be they'll be updated, and new ones will be posted as soon as we have answers that we can get to you.
Great. Thank you, Marianne. The next has to do with some eligible expenses related to, a lot of them related to COVID. And you had talked about how PPE was an eligible expense, an operating expense. Just some clarification. One, is there a list of eligible PPE that is available? And second is, are things like barriers, sneeze barriers, things that have to be fitted into a vehicle to protect the driver or in between passengers, would that be considered an eligible expense?
I think it would, again, if you're talking about is it eligible for operating,
Yes.
then the answer would be, if it falls into that category of something with a useful life of less than 1 year, then it would definitely be considered an operating expense, eligible. If it's, if you're talking about rehabbing a bus, then it wouldn't be. I don't know. So it's, in some ways it might be. I'm not sure where a sneeze guard falls in that category, but I think that's the general rule of thumb.
Okay, great. Thank you. There were two questions related to the 10% state admin, and can recipients and states use CRRSAA section 5310 for state admin?
CRRSAA is administered the same way that the regular 5310 is, and so I believe that the answer to that would be just similar to it. Yes, if it's eligible under 5310, it would be eligible.
Okay, thank you. Let me see here. We have one that says, we are a direct recipient that only used 5310 funding for vehicle purchases or other capital in the past. It would be a significant departure to use CRRSAA fund for operating purposes, and we need more guidance on how to do that. Can you provide that?
Well, first I want to say thank you to NADTC and to our other presenters, Jennifer and Jenna, for sharing their experiences, because that was part of the purpose of having this webinar, is that we're hoping that some, in areas where they haven't done some of these types of things, you can learn from your peers about how that can be done. So thank you to all of you. But beyond that, I would say to remember about section 5310, and some of our other presenters also mentioned this, mobility management activities under 5310 can be considered either an operating or a capital expense. So if you're doing mobility management, you may have always called it capital in the past because it was a more favorable match requirement, but you could, most mobility management activities are what would be considered very similar to operations activities. So that would be one way of going along on this. If all you've ever done is vehicles, then you may need to think more creatively about what you're going to do next, and maybe again take some of the examples that you've heard today. See if you think about what goes on in your area, what your subrecipients are doing. Maybe you want to conduct a new solicitation. That it's something that you probably need to determine on the local level how you're going to handle that. That would be my answer. I don't know if any of our other panelists want to chime in.
Anyone else? All right. Another question is, if a subrecipient is a nonprofit who may have troubles meeting all FTA pre-requirements, does the agency need to meet those requirements to receive CRRSAA funding for operating costs? Meaning, are there any waivers to any of those requirements of 5310 funding specific to CRRSAA funding?
That would really be for the subrecipient in question would need to work with their direct recipient. And so, FTA relies on direct recipients to oversee compliance of subrecipients. So if it's something that the direct recipient might feel they can work with them, if it's, and it would have to be, if the direct recipient is seeking, I mean, I mentioned, I guess I think I mentioned actually all of the exceptions. There aren't any more exceptions other than what I've mentioned specifically for CRRSAA. There is an emergency relief docket that if it's something related to the emergency, and then it's possible that there could be some relief provided, but that would be something that the direct recipient would need to work out. And we also are encouraging any direct recipients who are thinking about putting in a request through the emergency relief docket to talk to the FTA regional office. So I think that's an issue that just would need to be dealt with on a more specific level.
Okay.
Yeah.
Great, thank you. So there were a couple questions about the unobligated 5310 funds, and I know you had addressed that in one of the slides. So can you clarify again if match would be required for the unobligated funds, or if those are 100%?
If there is 5310, what I was saying was, what CRRSAA did was said, if there's 5310 money that's been appropriated in the past, actually up until FY and including FY21, but has not yet been obligated, it can be obligated at 100% federal.
Okay.
I think that was the question was being asked.
Yes, yeah. Yes, thank you, thank you. From this direct recipient, they had grants that were not funded in the last grant cycle. And they're asking if CRRSAA funds can cover the unfunded FTA 5310 grants that did not get funded in the last cycle.
I think that would probably be okay. Not knowing more specifics than that, but if there's been, what I'm interpreting there is that there's been a solicitation, they had excess, they had more than they could fund, and they'd like to go back and use that. I don't see why not.
Okay, great. Here's another one. For this direct recipient, can we do only one grant for CRRSAA funding for 53.7 and 53.10?
I'm going to ask that person to check with your FTA regional office.
Okay. Okay. Yeah. Are requirements for fair and equitable distribution applicable to CRRSAA funding?
Yes.
Okay. And if I remember correct, there's already a CRRSAA landing site on the FTA website that has some frequently asked questions. It
Yes.
goes into more depth. Is that also where they can find the allocations?
I believe so. The one way to get into that on the FTA website is there's a COVID-19 landing page, and then within that there's a frequently asked questions. The apportionments, I believe, for CRRSAA, they're probably linked on that COVID-19 page. They're also available through the regular, there's an FTA apportionment landing page. I believe that's also where the tables are. You can link to them in different ways.
Great, thank you. Can the state transfer CRRSAA Section 5310 funds from small urban to rural if needs in the urban area are met?
Again, I'll go back to it's administered the same way as regular 5310 funding. So that is something that's allowable under Section 5310 for state to do from small urban to rural or vice versa. So yes.
Thank you. We know there are transit systems providing service to people with disabilities and older adults in our region that are in need of operating assistance, but they're not listed in the Coordinated Human Services Transportation Plan. What should they do?
I think for that, you know, it is true that the Coordinated Human Services Transportation Plan requirements apply to CRRSAA funding. If you have procedures in place that allow you to amend the plan before obligating CRRSAA funding, you may want to do that. You may want to consult with your FTA regional office to see if there's some other some other way to address it. But you know, all I can say is that the Human Services Plan requirements do apply the same way they would for regular Section 5310 funding.
And do all activities need to be directly connected to COVID relief to be eligible for CRRSAA funds, like trips to vaccination sites?
They don't have to. They can be for any eligible activity under Section 5310.
Okay.
But they can be. There are ways of providing, you know, specific transportation to vaccine sites. We have a frequently asked question about that too. So,
okay.
Yeah.
Great. Another question, and this one may also be one that would be best directed to the regional office, but if they use a different process to allocate the CRRSAA fundings, do we need to detail that in the PMP or no?
I would say if they are doing something that's not already in an existing approved PMP, then they should document that. But again, you can discuss the details with the regional office, and they can give you more specific guidance for the particular situation.
Okay, thank you. Question for Jenna. For the purchased contract services, does your agency review those contracts after the 5310 funds are awarded?
Ooh, that's a great question. I don't know if we review the contracts. If we do, that would be something our compliance team does outside of my purview. But I can double check on that and get back to whoever that specific question came from. Yeah.
Okay, thank you. Here's another one. Are designated recipients required to sub-allocate the 5310 CRRSAA funds? Does the designated recipient have the option to retain a portion of the funds above and beyond the program administration and allocate the rest?
Well, for that, I would go back to what your what the program management plan is for that designated recipient, and if it's a serious departure from your approved program management plan, to discuss it with the FTA regional office.
Here's another one about the coordinated plan. We are in the process of updating our coordinated plan as the current one is expired. It will not be finalized until June, and we want to award the CRRSAA funds before then. Can we apply the parameters of our current coordinated plan?
Yes, if you have an existing coordinated plan, then, and if they, and what you want to do with the funds is consistent with that, then sure, that's not a problem.
Thank you. I'm scrolling through some of these questions here, and if you have any others, please put them in the question box. We have a few minutes left, so let me find some other questions here.
And sorry, I'll just add, we definitely review those because that's a procurement issue. So sorry, we definitely look over that to make sure that they're following all of like just all of the requirements related to procurement.
Okay, great. Thank you, Jenna. For those of you who asked the question of if this webinar will be available, it will be posted on the NADTC website in a few days. The recording, the transcript, and the materials will be there for you to view. Another one, and I'm trying to find it here, had to do with is if there was a separate application or how it was entered in, here it is. Are there specific guidelines for direct recipients to create Trams applications for CRRSAA funds?
I had some of the coding there was one slide in the webinar that gave the coding information. It does have to be a separate application. CRRSAA funds cannot be combined in one application with other funds from other sources. What was the did I address the question? What was the rest of the question? I forgot already.
It was about in the Trams system.
In the yeah. Otherwise, I would say just discuss it with your regional office. Whatever your specific questions are, they can address it.
And then just a clarification of date. A couple of people had said that they had seen a date that was January expenses after January 20th, but in the presentation it was said December 27th. So can you just clarify the dates?
Well,
that
the December 27th date is the date of that CRRSAA was enacted, I believe, and so I think it was talking about pre-award authority for CRRSAA funds specifically is available from the beginning of CRRSAA, December 27th. The other date that was back to January, I think, had to do with emergency relief. Go ahead, Destiny.
The CARES Act, the January.
Oh, that was the CARES Act. Okay, thank you. So that, and 5310, since we're talking about 5310 right now, 5310 was not included in the CARES Act. So if you're talking about 5310 funding, it would be CRRSAA funding, and the date for you would be December 27th.
Great, that's helpful. Thank you for that clarification. Yeah. I think we have time for one more question, and there were a couple people who asked this one about CRRSAA funding being used to pay for a contracted provider, somebody that is providing the paratransit service on behalf of the transit agency. Is that considered
that's allowable?
Okay, and is that considered an operating expense?
If they're providing operations, yes. If they're under contract to provide transit service, yes.
Okay. Let me scroll one more time for one or two more questions that we haven't answered.
Let me clarify that there may be an FAQ posted that addresses some contracts have a capital cost included in them. And I believe we have an FAQ posted that explains how that would be differentiated for eligibility for operating.
Great, that's helpful. Excellent. Well, I want to take this opportunity to thank all of the presenters for joining us today. This is a really important piece to get some of these 5310 funds out to the subrecipients and to particularly for those who benefit from these services. We thank you all for joining us. Please note that the presentation will be posted to the NADTC website in a few days. This is our contact information. You can also follow up with me if you'd like to be connected and didn't catch any of the presenters' contact information, or if your specific question was not addressed today, and we can get you to the right place. but we really appreciate you joining us. At the close of this webinar, there will be an evaluation, and we value your feedback to make what we do better in the future. So we appreciate all of our presenters today, Marianne and Destiny from FTA, Jennifer and Jenna. Thank you for sharing your experience, and thank you for sharing your expertise today. This now concludes our webinar. Thank you.